All right, so a little background on all of this. The Institute of Medicine gathered a bunch of data, okay, to look at the quality chasm. And basically, they realized there's just so much error that occurs. And not because people are bad at their job, just because in healthcare, it relies a lot on the human experience. And to err is human, as quoted a billion trillion times. Um, Before we started getting into quality improvement and outcomes, there was really no national tracking system. There was little accountability to improve quality and safety. Obviously, there was accountability in the fact that we wanted to take care of our patients, we want to avoid lawsuits. But even the idea of healthcare spending was not really in the eye because that really hadn't boomed yet or become this central issue in policy. So we had this decentralized healthcare system, and it became a barrier to quality and safety. So a patient could see multiple providers, and they're not able to share their information due to technology issues. And that's when the um, idea of the EMR came out, so that we could easily switch and share information. Thus came born the patient-centered medical home, where there is a centralized home, if you will, for your healthcare, and all of it gets fanned out and stays organized. So, in relation to med errors, the most common, according to the Identifying and Preventing Medication Error, that's the most common error in medicine, and it's particularly from nurses. And not because nurses are bad, but because nurses have a ton of responsibility, and they're the ones giving the medicine. Medication errors account for over 7,000 deaths annually, okay? And at least one per day will occur for an inpatient, which is crazy. I'm sure it's gone down, but this, since this book was out. And each year there's 1.5 million preventable med errors. Now, a lot of you can attest, especially if you work in like Bethesda, that you do like the scanning and all that stuff. And even then, there still can be error. So when you look in the text box 1.1, it talks about the Institute of Medicine Quality Chasm series. So to err is human. That is one of the breakout quality improvement articles that was written. And this is the first IOM report presented that aggregated data on the depth of quality and safety issues in the U.S. hospital. Okay. And it talks about how there's errors with blood transfusions, with getting the wrong body part operated on, and of course, medical errors. They even said that there's people died more annually of medical errors than in motor vehicle accidents, which is crazy. And when somebody dies from an error in healthcare, it's called a sentinel event. In 2001, the Institute of Medicine set a performance expectation called the safe, timely, effective, and efficient, equitable, and patient-centered. And these were aims provided to measure quality and align it with incentives for payment and accountability.